challenges associated with cultural adaptations for your evidence-based programs. I'm Caitlin, and I'll be your main speaker along with Nikki today, who will introduce herself momentarily. But before we dive in, I'd like to take a few minutes to just address some housekeeping items and then introduce the PRC members helping out with our workshop today. So for those of you who I haven't met yet, I'm Caitlin Dame. I use she, her pronouns, and I will be your main speaker today, along with Nikki, as I mentioned. And I received my master's here at CSU in prevention science, and during that time worked as a graduate assistant at the PRC, and then was luckily able to continue my journey here upon graduation. And for those of you who don't know, I am your main point of contact for this grant at the PRC, so please feel free to reach out to me with anything that you may need. I'm always happy to help in any way that I can. My email is shown here, and Nikki has also provided that in the chat for you. So now off to Nate.
Hi, everybody. I'm Nate Riggs. I'm the Executive Director of the Prevention Research Center here at Colorado State University. I did my graduate work at the Penn State University Prevention Research Center, and really excited to be here today. And I'll be helping out with some of the breakout groups. So looking forward to being able to talk to you in the small groups.
Yeah, hi, I am Nikki. I use she, her pronouns, and I am a research associate here at the Prevention Research Center of CSU, working alongside Caitlin with a lot of this work here. And just happy to share our tools and resources and hear what you have to tell us about your own communities today. So thanks for coming.
Great. And for those of you who have joined us for previous learning workshops, you may notice that we also have an additional member of our team with us today, and we're very excited to have her here.
Hi, y'all. My name's Alejandra. I use she, they, ella pronouns. I'm currently an undergraduate research assistant here at the Prevention Research Center, and my thesis focuses on cultural adaptation. So I'll be helping provide input just on the Latin side of things through my experiences and my knowledge on the subject.
Our agenda today is first going to provide you with a quick summary of important points from our Cultural Adaptations Part 1 workshop. Then we'll dive into best practices related to culturally adapting your programs, which will include how to consider balancing fidelity with your cultural adaptations. And then I'll transition over to Nikki, who will be discussing some cultural adaptation frameworks and additional best practices to consider. Then afterwards, as I've said, we'll take about 25 minutes to go into those small breakout groups. And then we'll close out just by providing you with some more guidance and some research-informed steps for deciding upon and implementing your cultural adaptations. Perfect. So as we reviewed in our previous learning workshop, adaptations are just any type of change made to an evidence-based program that deviate away from the program's manual or instructions. And despite this ongoing debate between strict fidelity versus adaptation to evidence-based programs, research has actually found that changes to programs are quite common when they're implemented in real-world settings. As a matter of fact, many researchers have even stated that program adaptation tends to be the rule rather than the exception when you're implementing programs in real-world contexts. But how do these program changes impact your evidence-based programs? As we discussed in our previous workshop, evidence-based programs are theoretically sound research-based interventions, and they've been thoroughly evaluated and are shown to continuously demonstrate significant positive improvements for their targeted outcomes, even when they're implemented in multiple naturalistic settings. And unfortunately, changes to these theoretically sound programs may have negative impacts on the desired outcomes. Since these changes to evidence-based programs are untested, we can't really reasonably be sure how they might impact your program or their participant outcomes, which is why it's important when making any program adaptations to always become familiar with the program's theory of change, which describes those critical and essential program components, and the program's specified logic model, which is just a visual representation of that theory of change and then how the program's components are linked to both those long and short-term outcomes. And really knowing and understanding these program elements will assist with ensuring that your program changes support rather than hindered the desired outcomes. And that was pretty much just a quick and dirty basic review from our Adaptations Part 1 learning workshop. I know that wasn't a lot. So if you would like to learn more, please visit our implementation toolbox or YouTube channel to review that material. But before we dive further into today's content, I would like to take a few moments for you to all participate in a little traffic light model pop quiz. This traffic light model for adaptations, which as you can see offers an analogy to differentiate types of acceptable program adaptations. And Nikki has gone ahead and posted this image in the chat for all of you. However, just for a quick review, the traffic light model consists of red light changes, and these are likely to negatively impact your program outcomes and should be avoided whenever possible. There are also yellow light adaptations, which often include adding or increasing the program's content, and these should really be approached with caution. And then finally, we have those green light adaptations, which are really just changes that are likely to improve or at least not really negatively impact the program outcomes, and they're generally okay to make.
So now that we've briefly reviewed the traffic light model for adaptations, we ask that you now think about and respond to a series of 5 questions related to cultural adaptations, 4 of which are related to the traffic light model we just discussed. And we ask that after each one is presented that you pause the video and consider how you would respond before proceeding on with the rest of the presentation. And to get started, we ask that you take a moment now to think about how making cultural adaptations makes you feel. So please take a moment now to pause the video and consider 3 to 5 words that come to mind as you think about how does making cultural adaptation decisions make you feel. Thank you for taking some time to consider that. Now we will shift into the traffic light model based questions. And our first out of 4 is, what traffic light color would you assign to the following cultural adaptation? Adjusting the program goals to match the cultural beliefs of participants. So please take a moment now to pause the video and consider whether you would assign this adaptation as a red, yellow, or green light level change. Our next adaptation for you to consider is updating the lesson with images that represent the culture of the community or participants. So please pause the video now and consider what traffic light color you feel this change relates to, red, yellow, or green. Next, we again ask you to assign a traffic light color, either red, yellow, or green, for the adaptation, replacing an activity with a more culturally relevant activity. So once again, please pause the video now and consider your response. And our final adaptation for you to consider is providing additional resources that support the cultural strengths and needs of participants. So once again, please pause the video and assign this change as either red, yellow, or green, and stay tuned throughout the presentation to check your answers for each of these 4 traffic light model questions.
So to start off our discussion about cultural adaptations, I would like to first start by defining culture and the differences between culture, ethnicity, and race. And culture is defined as the worldviews, experiences, and traditions that are often passed down within a group across generations. And a few examples of this include ability, age and gender, geographical setting, socioeconomic status, and sexual orientation or ethnicity. Whereas ethnicity characterizes different groups of people according to a shared culture rooted in a shared history and ancestry. And this may include language, food, music, dress, values, and beliefs. But the most important thing to understand is that culture and ethnicity are not interchangeable. Ethnicity is more about classifying people based on their national origin or culture, but not necessarily about understanding the worldviews or experiences of a specific group. And alternatively, race is more about the social construction and categorization of people based on perceived shared physical attributes, which unfortunately tends to result in the maintenance of biases and the placement of people in boxes according to their looks, instead of really working to understand their worldviews and individual experiences. And so that's just the basic summary of differences between culture and ethnicity and race. However, if you would like to look for a more in-depth understanding or for more recommendations related to working with various cultures, we really do recommend that you reference the American Psychological Association's 2021 Inclusive Guidelines, and Nikki has posted this for you in the chat. And we really hope that you find this to be a helpful resource as you work with members from all different communities. So what are cultural adaptations? With these definitions in mind, cultural adaptations rather are basically the same thing as original adaptations. The definition doesn't really change. They're still considered these changes or deviations away from implementing the original evidence-based program as intended. However, with culturally based adaptations, we're now adding on that sensitive topic that we just discussed of cultural norms, beliefs, and values to improve the program process for a population in which the program was likely not originally designed for. And this may lead program implementers to make changes to a program's visuals or activities, location, statistics, language or facilitators, music and setting, evaluation measures, or even recruitment strategies and materials to really just improve that program participant fit. And the same best practices that we discussed in our Adaptations Part 1 learning workshop still apply when making these cultural adaptations. You should still utilize the traffic light model for adaptations to consider acceptable changes. Additionally, you should still think about the common sense plain cake model with variations for when deciding what adaptations to implement and how to do so. And we definitely will always encourage you to collaborate, evaluate, and communicate your findings as a team throughout this adaptation process, and to do your best to consider and make adaptation decisions before implementing them. However, there are also a few things to keep in mind when making cultural adaptations that may make finding this balance between fidelity and adaptations even more challenging. So to assist with this, we suggest that you discuss the following questions as a team whenever you're considering implementing cultural adaptations. First, ask how in depth should culture be considered versus how far should fidelity be considered. And this is when it really may be helpful to refer to this adaptations continuum to determine at what end of the spectrum your suggested changes align. And so to loop back to the questions that were just asked during that Mentimeter poll, we have green light changes that may consist of updating the lesson with images that represent the culture of the community or participants. And these type of program changes are placed closer to that no adaptations end of the spectrum, as they're more likely to maintain implementation fidelity. And then there are these yellow light changes, which may include replacing an activity with a more culturally relevant activity or providing additional resources. And kind of a helpful reminder for these yellow light changes is that they typically do include replacing or adding kind of resources, which can start to cut into the original program content and impact dosage and other things. So that makes these types of changes fall closer to the middle of this spectrum in between that 100% fidelity and culturally grounded approach. And then finally, we have red light changes, which include adjusting the program's goals to match the cultural beliefs of the participants. And this is a type of change that is really more likely going to lead to the collaborative development of a new program instead of the replication of the originally selected program. And when you start to consider these red light adaptations, this may lead your team to wonder, is it time to start considering implementing an alternative program? However, if you and your team do decide that many of these changes are categorized as green or yellow light, then proceed and utilize the common adaptation best practices, and also proceed with care and caution. But most importantly, with cultural adaptations, gain and utilize participant responsiveness data and other community-based information to inform your adaptation decisions and implementation. So given all these tricky guidelines around cultural adaptations, you may be asking yourself, why make them? By now, you're probably starting to realize that making cultural adaptations to your evidence-based programs can be extremely challenging. However, in order to promote positive and equitable change within your communities, it may also be extremely necessary. And these types of adaptations are necessary because often the selected evidence-based program does not 100% match the needs or values of the subcultural group that you're working with. So this leads your implementation team to search for solutions or changes that more accurately accommodate their unique communities. And these accommodations most commonly lead to changes in the program's recruitment processes or the program activities or content to increase participant engagement and retention. And one example of program participant mismatch that you can see included in this chart and that we'll be discussing more today is implementing a program created for participants of average socioeconomic status into a group that's classified as lower SES. And this really may cause the need for implementers to alter references included in the program content to ensure that they more accurately reflect this group's cultural experiences. or even to go into those yellow light changes of including additional resources. And this chart, as you see here, includes several other examples and is available to you through our cultural adaptation research to practice tools that you can find on our implementation toolbox. And I also wanted to mention that cultural adaptations to evidence-based programs are also necessary for really improving the reach of evidence-based prevention programs and resources for all individuals. And this is really important because it improves the promotion of equitable behavioral health. By adapting programs to better reflect the ways in which your participants perceive health, illness, healing, and wellness, you're assisting with decreasing the health disparities gap for underrepresented communities.
Great. So I just want to talk a little bit about cultural adaptations and some other considerations. Let me clear out all my slides here. So as we can see, clearly cultural adaptations are important, but they're also difficult to make. How do we know if the materials you want to include will be well perceived or even align with the program theory of change? And this is especially true because these are culturally adapted programs. They have not been tested, so it gets a little tricky. So I want to go over some frameworks with you guys. A lot of them actually do overlap with similar theories, so I'm just going to go over 2 of them today. So the first one being, there we go. The first one being the ecological validity framework by Bronfenbrenner. So if you're familiar with Bronfenbrenner's work, you might be familiar with the ecological systems theory, which basically emphasizes the direct relationship that an individual's environment has on their overall development, such as the image here, starting from proximal at the individual level and ranging to distal environments as well. So the ecological validity framework, the basis of this is to use the concept of ecological validity. So ecological validity is essentially a notion of how well the program aligns with the cultural experiences of the participants. So this highlights the importance of understanding the unique cultural experience of participants rather than just following assumptions, right? So this framework offers 8 areas to make adaptations. So we are going to try today to map that onto that traffic light model, which we talk a lot about. So this color spectrum on the left side is to represent green, yellow, and red light changes. So let's go over these 8 areas. The first would be the most green one we could say. So this would be adapting language, which is very common and often needed if participants speak a different language than what the program was originally designed for. Then we have metaphors, which can be both verbal and visual. Moving next to persons, a common thing with this category could be ethnic matching. So for example, just considering, is it important to think about implementers or facilitators matching the participants on some kind of level? For example, speaking the same language would be something very important. But there are other areas too that could help the participants connect with the facilitator. And we'll move along to content. So you can see now we're kind of getting into that yellow light category here. I mean, looking at the definition here, accommodating values, this can be very important, especially when we're trying to gain trust with the community. We really want to increase the participant engagement. So content is really commonly adapted, but just remember, it's very important to keep the program goals and theory of change intact. So we'll keep on stressing that a lot. And I did want to kind of take a moment to give an example with this. So say, for example, community norms include alcohol consumption as a community connector. So we actually see that a lot in Fort Collins just with our breweries. So, you know, I'm sure it's true in a lot of other areas in Colorado, but especially in Fort Collins, you drive by a brewery, you see it's packed at any time of day, but it's families, it's all ages, youth and adolescents as well. So for example, say we are implementing a family program that is designed to prevent underage drinking in Fort Collins. So in this case, additional material might be warranted and probably ideal as well. So maybe we need to include content and in a way that we are adding content that recognizes these cultural norms that are favorable towards alcohol use. But at the same time, it might also be important to differentiate adult alcohol use versus adolescent alcohol use. So for this example, maybe we want to add content, but that content should be research-based in identifying the risks associated with underage drinking. But then say on the other hand, maybe cultural norms in a community are actually favorable towards underage drinking. And we do see that sometimes. In this situation, it's really important to first know if the community identifies underage drinking as a problem and how they view this program in general, because that's the goal of the program, right? So to prevent underage drinking. So this really goes back to understanding the community culture and how they define the problem and selecting a program from the start that's going to fit with your community and their belief system. So we'll talk a lot about this as we continue. But I'll move on to concepts as the next area for adapting. So concepts can feel a little abstract, but maybe consider, are we working with collectivist culture, participants versus individualist, for example? And then we go to context and thinking more environmental aspects. So an example here could be, say we know that we're working with low income communities. Maybe we want to consider adding transportation vouchers for accessibility to the program, or maybe we need to think about having a list of referrals of providers who accept Medicaid for, say, substance abuse. And then we're getting a little bit more red here as we continue on. So now we're to methods. And basically, the way I view it is if we're changing the way we are reaching our goals, then we're really altering the theory of change. And as you know, the theory of change is an evidence-based design or a tested theory that informs the structure of the whole program and what makes it work. So a lot of these theory of changes will include moderating and mediating effects that have scientifically linked the program's risk and protective factors to the program goals. So we can't really mess with that. And there is a final area of adaptation, which is goals. And this is about as red as you can get here. If you need to adapt the program goals for your culture, then you're probably just implementing the wrong program, like that example of underage drinking. And just a note on this framework, it is originally designed for adapting in clinical treatment settings, otherwise known as evidence-based practices. So when we take this and apply it to programs, which is very common, we do just need to be a little bit more careful. So hopefully applying this to that green, yellow, red light model was helpful for you today. And this is going to lead us into our next framework, which talks about surface structure versus deep structure adaptations. So this is called the cultural sensitivity framework. It's a pretty popular framework, and some of you might be familiar with these terms. But essentially, the emphasis here is based on mixed methods research. So by mixed methods, we mean research approaches that include a combination of both quantitative and qualitative data that are already existing and newly collected data. So just getting a wide range. The main thing here is cultural sensitivity. So this refers to how in-depth the culture is considered in the design, the delivery, and the evaluation of the program. So in other words, asking, were beliefs, values, experiences, and environmental aspects of a given culture considered here? All right, so let's dive into what we're actually talking about here. So this visual outlines surface structure adaptations. So these are more basic, they're typically observable. Things like adjusting visuals, music, and language. These are really common ways to adapt a program, and these do tend to be more of those green light adaptations that we've identified in our traffic light model. And additionally, things could be, examples here could be changing session titles, changing the setting, or thinking of program access like those transportation vouchers I mentioned. And then below we have the deep structure adaptations. So these are much more abstract. These tend to focus more on the root cause of a specific problem, thinking about systemic or environmental impacts on a culture. So with deep structure adaptations, discrimination, oppression, and stigma are all very important to consider. Also things like worldview, norms, and belief systems. So I have the example here. How does the culture fit into Western society? That's a guiding question I would say is good for deep structure adaptations. Maybe thinking, is the culture collectivist? So in collectivist culture, relationships are more interdependent, where decisions are made more so for the whole family or the whole group. This is pretty common in East Asian cultures. Or are they an individualist culture, which is more of a norm here in the US, where independence and individuality is more of a norm. And just a few more guiding questions and examples would be, how has this culture historically been impacted or treated by society? What policy should we consider? How have previous relationships with prevention programs been? Maybe relationships with healthcare professionals, academia, or human services, for example. And so we at the PRC would argue that these are all really critical aspects to consider. These are sensitive topics, and they're really important when it comes to building trust with the community. And it would also allow for a more in-depth alignment with cultural values, right? But still, we do want to say that these deep structure adaptations should just be considered with caution. A big note about this framework is it is still debated, like that fidelity versus adaptation debate, which is best. Surface structure versus deep structure, it's not clear in the literature of which one is best, but we would say consider both of them. But really, at the end of the day, it's really going to depend on how the adaptations or how these considerations are converted to the actual adaptation itself. So what we recommend is still sticking to that traffic light model because it's more of a concrete approach of identifying it green, yellow, or red light change. So in this sense, we could look at deep structure as leaning more towards red light change because it is just more likely to alter those core components if you're talking about deep-rooted belief systems that might affect the theory of change or the goals. So at the end of the day, when using this framework, really just depends on the adaptation itself. Are you removing program content? Are you contradicting the theory of change? Because these things would most likely decrease program outcomes and impact. And I just want to share an example from the literature. So when implementing Guiding Good Choices program, there was a cultural adaptation, which included removing components for cultural needs, basically. So in that example, that cultural adaptations of removing content actually did increase the program engagement and recruitment. However, the original EBP that was not culturally adapted still had better outcomes because the content was not removed. So just because we want to really align with the values of the culture does not always mean that we will be seeing the outcomes that we want to see. So just be cautious in how you're adapting. So how far is too far? It's definitely possible that some cultures and communities would benefit more from these deep structure adaptations. We just still recommend sticking with that traffic light model with those adaptations and just assessing it on a case-by-case basis with a team. It's important to also consider, is this adaptation justified? In other words, is it needed? And how high is that need? So according to research, high needs equal high benefits. So in other words, participants who show the greatest need for accommodations receive the greatest benefit from those cultural adaptations. And with this literature, it's also suggested that participants with lower levels of acculturation have the highest need for these cultural adaptations and therefore will benefit the most. Another thing for this is it justified piece is thinking about who is the subcultural group that you're looking for or working with. So we know, for example, we have a broad culture and we can identify that easily, but it would be very beneficial if you're able to dive deeper into identifying that subcultural group. In other words, the intersection of cultural elements. So here's an image here used a lot for intersectionality theory. So you can see all these different identities floating around. These are basically different cultural identities that can all define one person. So if, say, for example, we know that we are working with a Latinate population, maybe we can also identify that this group of participants is also similar in their immigration status and their income level, for example. It could be really helpful to know those things because this is going to help us better understand who we are working with, which will help us better understand what adaptations to make. And in this example, it could also help us understand how acculturated is this group expected to be, because that can help us understand how high the need for a cultural adaptation will be as well. I just want to note, don't give up on working with a program developer if that is an option for some of you. Sometimes it can be really difficult to connect with them, but we've had both good and bad experiences, and the good experiences have been really helpful where program developers have actually already had program material ready for us and really willing to work with us in our cultural adaptations. So consider that as an option that might save you a lot of time. And finally, just remember that evaluations take a lot of time, but they are super important, especially because, like I said earlier, these are not tested programs. We are working on culturally adapted programs. So it's just important to just evaluate. And if you don't have the capacity within your team, it's really normal to just hire someone outside of your organization. Like for example, the PRC does program evaluations, among many other. So just something to consider. So moving along, I want to talk about cultural humility, and I am a fan of this video. It's pretty short, so I'm going to go ahead and play this for you. It's just going to kind of go over and defining what this means.
Cultural competency and cultural humility. You may have heard these terms before, possibly in the context of healthcare settings, and not quite understood what they meant. Let's go over what these terms mean.
Sorry, let me mute myself. Hang on a second.
And how they apply to everyday life.
It's like not letting me go to Zoom. Oh, it's over here.
To be culturally competent is to learn about other cultures, control your biases, and adapt your behaviors and communication style considering the background of people around you. The goal of cultural competency is effective and informed interaction across various cultures. At face value, cultural competency sounds ideal, but it may actually lead us to rely on generalizations about certain groups rather than recognizing the uniqueness of each individual. We also have to ask ourselves, is it realistic or even possible for people to learn everything about other cultures and become completely bias-free? That's where cultural humility comes in. To be culturally humble is to be aware of social power imbalances, respect other people's values and beliefs, and continuously your bias. With cultural humility, there's no expectation that you memorize everything there is to know about other groups. Instead, it's a lifelong process of asking yourself how your own biases might impact the way you treat and understand others, alongside work to minimize that impact. Cultural competency is a goal, while cultural humility is a mindset. Let's go over a few ways to practice cultural humility in our daily lives. Recognize that no culture is superior to another. Become comfortable with reflecting on and acknowledging mistakes you've made. Be honest when you're not sure about something. Learn about other cultures with the awareness that you'll never reach perfect understanding. Ask the people in your life if you can have open discussions and hold each other accountable during your learning journey. The great thing about cultural humility is that it acknowledges that no one can get it right all the time. In fact, a key component of cultural humility is being open about what we haven't learned yet. Although it can feel really uncomfortable to admit when we're wrong or don't know something, that vulnerability leaves room for us to continuously learn, grow, and promote equity and inclusion in our communities.
To talk a little bit more about cultural humility, part of this is building trust among communities served, which is very important if we want to be working with them in terms of cultural adaptations. So things to consider would be like, where do you stand as an implementer or an organization coming into a community? And also, what has that relational dynamic been like for them in the past? And what can you do to establish trust moving forward if that's not something you've already done? And cultural adaptations, of course, require cultural humility. So obviously, you know your community best. You know a lot about your culture and your community. But even so, you still, without outside perspectives, you only know your own experience within that context. So these are your personal biases. So we suggest that you work to seek experiences of others as well.
And we recommend this by working directly with community members, primarily through advisory committees, community needs assessments, and diverse coalitions. We actually have a lot of resources for this on our implementation toolbox, which you probably already have access to that, but we'll send you info on this towards the end of our workshop today. I do want to touch base briefly though on advisory committees, because this is something that we really recommend doing and something that we like to do a lot at the PRC. Sometimes these are also referred to as advisory boards or advisory teams, if you're more familiar with that term. But we do recommend using advisory committees to help you make decisions throughout the program implementation. Ideally, your members should be invested in the program, organization, or general social initiative. And ideally, members are a voice for the target population you're working with. They are small groups of community members or key partners who work in a collaborative leadership role. Ideally, they are representative of the culture and community you are working with, but also consider that they should be diverse in some other ways. So say you are adapting for a rural culture, that rural identity is important, but also diversity in other ways is important, such as gender, ability, age, and ethnicity, for example. And in addition, don't ever rule out the voice of adolescent or youth community members as well. Those can be really critical. And finally, ideally, members will be recruited locally. So think government, nonprofits, past program alumni, community members, or youth centers. And another note here is that your agency will cultivate a bidirectional relationship with the advisory committee. So expectations and success will be collaboratively defined at the start of the partnership. And like I just mentioned earlier, also consider diverse coalitions and community needs assessment.
Part of it is really trying to ensure that you are on the front end identifying evidence-based programs that are going to fit your community's own unique context and culture. So there's a good amount of work that goes in on the front end and doing that, doing the homework and really identifying, is this program going to fit in my community? Is it going to fit in my culture, my audience? So there's that piece to it. There's also, but those programs need to exist, right? So program developers need to develop programs that are going to be responsive to diverse cultures. And right now, the field, there are fewer of them than there need to be. There are some evidence-based programs that have been developed specifically for culturally diverse families, and you can find some of those on these registries of evidence-based programs like Blueprints and What Works Clearinghouse. There are other programs that were originally developed for majority populations, primarily middle income, suburban white populations that have been adapted for culturally diverse populations. So, but still, the field of prevention science is still building up a library of those programs so that communities can select from a number of them. They're the ones that fit best. So that's kind of where the field is generally. And I think where the funders come in, so for example, CDPHE is when possible, providing grantees with a menu of programs, of approved programs that are culturally responsive. So so it is kind of a three. There's three elements to it. There's the developers end of it, where the developers need to be developing programs for diverse populations. There's the grantees who can do the homework on the front end and identify evidence-based programs, or we can help provide training and technical assistance to grantees so that they can identify programs that are going to work within their own context and culture. And then there's the funder piece of it, where the funders can do their homework too and identify more evidence-based programs that are culturally responsive.
to make up for the in-person small group discussion portion of this workshop, we ask that you consider the following scenario. Your organization is planning to implement a family-based program to reduce substance use and increase familial communication skills for a community that is dominant in either Latin culture, low SES, or rural farming culture. Because the original program selected for implementation has not been previously tested for any of these three specified cultural groups, implementers within your organization are anticipating the need to adapt the program to create a better fit between the program and their participants and community's cultural strengths and needs, which will lead you to consider a series of questions related to the cultural adaptation of your selected evidence-based program. So please take a moment now to consider this scenario and select one of the three cultural groups, either Latin, low SES, or rural farming culture. And you will use this scenario as you consider the following questions. First, given what you know about your selected cultural group and making adaptations to evidence-based programs, what is unique about this culture that may require adaptation considerations? Now that you've brainstormed some potential factors, what is the first step that you could take as an implementation team to adapt the program with cultural humility? Now brainstorm, what are some adaptations you could consider implementing? Then categorize each of your selected cultural adaptations as either red, yellow, or green light according to the traffic light model for adaptations. And consider how this level might, as a red, yellow, or green level of cultural adaptation, affect implementation fidelity or program outcomes. So please pause the video one more time to consider your selected scenario and these 5 questions. And if you have any questions or points that you would like to discuss as you work through these questions, please do not hesitate to reach out to the Prevention Research Center. We're happy to help.
We've created an implementation fidelity and adaptation guidebook for community-based interventions. It has a lot of the information that we've discussed today and even more. And we will be posting this on our implementation toolbox soon. However, there are some electronic accessibility things that we've got to take care of first. So for those of you here today, Nikki's going to provide that in the chat for you. In addition to a link to our implementation toolbox, which contains 2 cultural adaptations research to practice tools that we've created. This first one really talks a lot about kind of those frameworks that Nikki was going through and best practices. And then the second one gives you a really nice step-by-step guide where the PRC has taken several very intricate models according to research and kind of reduced it into 7 steps for you to consider as you begin culturally adapting your programs and then implementing those adaptations with staff. So sharing your findings, that's a really big piece. We've talked about the documenting and evaluation part, but it's also very important to share your outcomes. And we do realize that there's some frustration, I guess I'll say, in the prevention science field about where you can share these findings, especially if you're not researchers and you're not publishing in these journals. How do we get this information out to people who can actually use it? And we've kind of through research found that newsletters and blogs, handouts and infographics to your community and stakeholders, social media posts, networking events, learning communities, or even workshops are all great resources for you to kind of use and get the word out. And then these are those 7 steps that will be listed in the program guide: understanding your subcultural group, which Nikki got into quite a bit, selecting the evidence-based program based off of what you know, which we discussed a little bit in our group breakout, and then connecting with those program developers and experts, always adapting and training your staff, then doing the test run and evaluating what you find, revising and re-implementing if necessary, and then sharing those findings like I discussed. But again, all of this information goes into more detail in that second cultural adaptations tool. So before we close out today, there was one piece that I really wanted to highlight, and we do have a research to practice tool on this, but Our final recommendation for you today is to really just always consider inclusion whenever you're implementing or adapting your selected programs. And we, as I mentioned, do have this LGBTQ+ research to practice tool on our implementation toolbox. And this will really assist you with considering green light program changes that can be implemented with most programs, just to ensure that you're being inclusive of all identities and cultures. And these changes can be implemented with relatively little effort, but they result in really big positive impacts. And this may include using inclusive language or images like we've discussed to help participants feel less invisible, but it can also include some yellow light changes as well, such as adding those additional supports. But of course, any changes should always be recommended by your additional research and advisory committees. But we really want to stress that considering these changes is especially important, obviously, if you do have participants who openly identify as LGBTQ+, but they're also good to consider even if you don't have participants who openly identify, because recent research has really shown a steady generational increase in the percent of people who identify as LGBTQ+. But unfortunately, social stigma and experiences of discrimination and victimization really put these individuals at higher risk for substance use, mental health concerns, and family rejection and homelessness. However, as prevention specialists, we can cultivate affirming environments and adapt our evidence-based programs to really be sensitive to these individuals' needs and assist with fostering resilience. So just kind of to take this all home today, there are several cultural adaptation frameworks available to help guide you in your decisions. However, there's not really one singular framework that will guarantee that fidelity adaptation balance. When implementing cultural adaptations, it is essential to always approach them with cultural humility and sensitivity, not assumptions. Collaborate with your communities, understand the best practices that we've described today and further on our implementation toolbox and in our guidebook, and always document, monitor, and evaluate any and all adaptations made. And our final thing for you to leave with today is that you should not feel that you've failed as an implementer just because your adapted program didn't work. The important thing about adaptations is that we don't really know how they're going to impact the outcomes. So sometimes you just have to proceed with best practices and document what happens. Prevention science is still a relatively new field, so as long as you're evaluating and documenting and sharing this, then you're really helping to assist the field move forward. That's all I have today. Thank you so much for your time and participation. Nikki's also posted that implementation toolbox link for you, in addition to a link for our new YouTube site that contains these learning workshops, as well as short deeper dive videos and other prevention science resources for you.